Hello, my name is Oleg. It is 7:55 a.m. September 8th, 2012, Saturday. I could not sleep. I have racing thoughts, so I skipped a night of sleep. Um, if anybody out there is interested, maybe starting a nonprofit organization in the United States, educating people about healthcare, and because they're believers in, I guess, a socialized healthcare system, or a healthcare system because we have that is paid for by the taxes. Basically, let me explain this to you. This is the formula that needs to happen. This is the current formula that we have in the United States. The citizen pays the tax dollar. From the tax dollar, we have some government insurance or government insurance or whatever. It's just a mess. The Medicaid, Medicare. Then we have private insurance. And in order for the citizen to get treatment from the doctor, whose function in society is to serve, to treat the citizen is forced to either go through Medicaid, Medicare, and private insurance. And there's just a lot of waste. Now, this is the system that needs to exist. The citizen gives the tax dollar. The tax dollar goes into the doctor, and you have a relationship between the citizen and the doctor, and nothing more. This is the fundamentally perfect healthcare system. I'm not sure if this is how it's done in other places of the world, but this is the perfect system. And it's, if you're wondering it's too simple, etc., etc. Well, in the United States, we have a government of, by, and for the people. And that's quite simple. That's a sentence. But yet our government is very complicated. We have a lot in our government. You cannot just explain our government by saying a government of, by, and for the people. But that's the government that we have. So basically, this is the blueprint that needs to be taught to people, because people are miseducated on the idea of healthcare. They think that it's some sort of I don't know. They're just simply they're just uneducated about it. Well, there's one thought that maybe plagues some people. They feel that because we have some sort of a system where the doctor can make as much money as he so desires, we are competitive, because the human desire for greed creates competitive medicine. I disagree with that idea. The medical discoveries are not made through greed, but through experimenting, through experiencing. The longer the doctor does something, maybe thinking outside the box. I highly doubt that doctors out there are thinking outside the box for the sole purpose to put money into their pockets. I'm sorry if I'm a bit stumbling here. I did not sleep, and I hope to have your attention. Anybody interested in this? Um, this would you'd be able to make a decent living doing this, educating people. The non-profit organization. This is quite simple, really. This is the blueprint. Again, it needs to be worked on a little bit in terms of explaining it, but fundamentally, this is the perfect system. Um, there's other concerns, because we have members in our society, in our American society, who would think of this as communism, as Russian communism, because at some point, I don't know why, but people thought that the Russians were going to invade the United States, and communism is evil and bad and ooh. But we have people members in our society who feel that. So so that tells me that it's an educational problem that we have. Okay, I wanted to share that tidbit, as that is the perfect, fundamentally perfect healthcare system. If you have an immediate relationship with the doctor, today, uh, I don't want to waste time convincing anybody. Simply, you understand this or not. Okay, adios.